Coughing, sneezing, and stuffy noses are common this time of year, but how can you tell if it's a cold or allergies?
Newswatch 16's Carrie Cairns is here to help us understand the difference. Carrie.
Yes, Lisa. Allergies can occur in winter, not just in spring and fall. This time of year, they are mostly caused by indoor allergens. In this Healthwatch 16 report, we explain the differences between winter allergies and a cold, along with treatment options.
Healthwatch 16, sponsored by UPMC, life-changing medicine.
Are you going through a lot of tissues this time of year? If so, it's likely due to a cold or winter allergies. While germs are often the primary cause of a cold, winter allergies are typically triggered by indoor allergens.
Those would include things like animals, dust mites, any kind of insect pests, whether you have it's called multicolored Asian lady beetle, which is basically an invasive ladybug species that came into the country in the early 1900s. And it comes indoors in the winter. And then if you happen to have hundreds or thousands of them, you could be allergic to them.
Dr. Nathaniel Hare is an allergist and immunologist at UPMC. He says the symptoms of winter allergies are similar to those experienced during seasonal allergies in the fall and spring. However, the triggers differ, and it can sometimes be challenging to distinguish between those allergies and a cold.
Basically, if you get a fever, that for sure says it's not allergy. If other people in your household have it, it's probably not an allergy. But some of the symptoms may be hard to differentiate. Maybe more itchy, watery eyes if it's allergies, a little bit less of that, maybe not at all if it's a cold. But as far as the nose, symptoms can overlap: stuffy, runny, sneezy, drip in the back of the throat.
Dr. Hare says it's also important to keep an eye on the duration of your symptoms.
The cold tends to last, 1 to 2 weeks at most. So if you're finding symptoms are ongoing and just continuing past that without any relief, then it may actually be an allergy.
And you can manage winter allergies just like any other allergies.
So you can try to minimize exposure. If you know what it is, you can try medication or sinus rinses or both. And you could look at it, potentially talking with an allergist about doing allergy immunotherapy injections if you know what your allergen is, to try to reduce or eliminate your immune response causing symptoms down the road.
And Dr. Hare notes that tree pollen will begin to appear in 2 months as we approach spring. And allergy symptoms typically affect patients around the middle of April. Carrie Cairns, Newswatch 16. Lisa, Stacy, back to you.